I have many patients in whom we've performed limb salvage. There's a lot of misperception around limb salvage. Actually, many of those patients in whom limb salvage is recommended have very, very simple lesions that could have been treated, but their physicians don't even get an ankle brachial index, much less any form of imaging like angiography or even duplex angiography. But one case in point, there's so many, because we perform every week, certainly tens of limb salvage procedures every week. But one patient in particular I remember very well was a young woman who, when she presented to me, was only 27 years old. She had had her first bypass on one leg at age 21 at a very famous center in the United States, and over the ensuing years had had 7 bypasses performed on both of her legs. She was not a diabetic. She had minimally smoked in the past, and I don't totally know what was the cause of her blockage. Biopsies had been taken at that hospital, and unfortunately, I've never been able to obtain those reports. But she ultimately developed an ulcer on her left dorsum of her foot. She was a single mom. She had a 4-year-old child. She was the lone source of income for the family. She was working in exquisite pain all day long to support her child. She was going home, teaching her child, spending moments, taking narcotics to sleep. That was her life. She got to a point where she couldn't stand the pain anymore, and she went back to that very famous institute. And they said, all we can do is amputate. And by the way, we should amputate both legs. She went through psychological counseling and was scheduled to have the surgery. She deserted the hospital against medical advice the morning of the planned surgery. She went to Emory and was sent to me. We were able to save that limb and her other limb. That was now 9 years ago. She has gotten remarried. She's had another child, and she runs on both of her legs. Now, she had very complex anatomy, and it was difficult to open. But there are avenues for most patients with peripheral vascular disease to achieve limb salvage. Hers happens to be an important story because she was 27 years old. Hers happens to be important because she had so much of her life expectancy ahead of her. But this is true even for the 90-year-old. Should a 90-year-old have to have pain with everything they do when there is a viable option? Our treatment practice of simply not making diagnoses and not offering patients the most advanced therapies because of age, because of other reasons, or because of lack of expertise is wrong, and we should change it.